let's check out the prevention and complication of type 1 diabetes. Unfortunately, there will be no cure for type 1 diabetes, but scientists are working on ways to prevent or slow down the progression of this disease. Scientists are also working on research into pancreatic islet transplantation, which is one of the treatment options for brittle diabetes. Once a person gets this disease state, he have to get the treatment for the rest of their lives. People can feel healthy and avoid diabetes problems by adopting appropriate treatment plans and by follow healthy lifestyle. As far as prevention concerns, unfortunately, there is nothing we can do to prevent this disease type. Since type 1 diabetes can run in families, the healthcare provider can test all of family members for the autoantibodies that cause the disease. The presence of antibodies in the body, even without the symptoms of diabetes, point out that the person more likely to develop type 1 diabetes. If anyone in your family have type 1 diabetes, you have to do the autoantibody test. This test can help to catch type 1 diabetes in its earliest phases. Complications of type 1 diabetes are diabetes-related retinopathy, which is a retina damage of a diabetic patient suffering from type 1 diabetes since long. Second is diabetes-related macular edema, which is the leakage of blood vessels in retina of the eye. Third is cataracts and glaucoma. Cataracts typically come on gradually, causing a change in the eye's lens over time, resulting in cloudiness, which reduces vision. Glaucoma encompasses a group of eye diseases characterized by a buildup of intraocular pressure, IOP, that causes damage to the optic nerve and subsequent loss of vision. Diabetic patient also suffers with low healing process. Foot problems, including ulcers and infections, that can lead to gangrene. One of the main complications is the occurrence of heart disease. Over time, high blood sugar can damage blood vessels and the nerves that control your heart. People with diabetes are also more likely to have other conditions that raise the risk for heart disease. High blood pressure increases the force of blood through your arteries and can damage artery walls. Other complications related to diabetes mentioned in this slide, in which there is high blood pressure, diabetes-related neuropathy, stroke, kidney disease, and occurrence of bacterial and fungal infections, and diabetes-related dermopathy. High blood glucose, also called blood sugar, can damage the blood vessels in your kidneys. When the blood vessels are damaged, that don't work as well. Many people with diabetes also develop high blood pressure, which can also damage your kidneys. Kidney damage may begin 10 to 15 years after diabetes starts. As damage gets worse, the kidneys become worse at cleansing the blood. If the damage gets bad enough, the kidneys can stop working. Kidney damage can't be reversed. Diabetic neuropathy is nerve damage that is caused by diabetes. Over time, high blood glucose levels, also called blood sugar, and high levels of fats, such as triglycerides, in the blood from diabetes can damage your nerves. Diabetic neuropathy has no known cure. The goals of treatment are to slow progression, relieve pain. Excessive blood glucose can result in increased fatty deposits or clots in blood vessels. These clots can narrow or block blood vessels in the brain or neck, cutting off the blood supply, stopping oxygen from getting to the brain, and causing a stroke. Diabetes-related dermopathy is a harmless skin condition that affects people living with diabetes. It looks like small, round brownish patches. There's no treatment for diabetes-related dermopathy, but makeup and moisturizer can help with its appearance. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.